Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's news conference. Spanish interpretation of the media availability is on ATXN 3. To start, Austin Public Health Director Stephanie Hayden will first say a few words, followed by Dr. Jason Pickett, Austin Travis County Alternate Health Authority, then Janet Pichette, Austin Public Health Chief Epidemiologist. We will then open it up to the pool reporter who will ask questions on behalf of the media. Stephanie, over to you.
Good morning. I would like to start by just really encouraging families to be very safe this holiday. I understand that we will make the decision that we feel is best for us and our family, but I encourage you to be safe. Just reminding you about the 3 W's. Wash your hands, wear your mask, and watch your distance. And if anyone in your family is sick, please have them not to be a part of the gathering. At this point, I'm going to transition over to Dr. Pickett.
Hey, good morning, everyone. And I want to start by wishing everyone a very happy and healthy Thanksgiving holiday this week. There are ways that you can make your holiday safer and happier and healthier. One of them is to avoid gathering with folks outside of your immediate household, to stay away from crowds, to stay away from groups. Now, we understand that some folks have already traveled, and if you've already come here, if you're already at the gathering, things that you can do to make that safer include wearing your mask, gathering outside instead of inside, and decreasing the number of people that are indoors together. I'm going to go ahead and turn it over to Janet Pichette, Chief Epidemiologist.
Good morning and happy Thanksgiving, everyone. I'd just like to take the time right now to wish a happy Thanksgiving to the staff at Austin Public Health who've worked tirelessly since early January on the COVID response. And we're often a group of first responders who are not often seen, but they will continue to work over the holidays. And while you're enjoying your Thanksgiving festival, they'll be continuing to work on cases that are coming into Austin Public Health. I'd also like to reiterate 3 things that both Stephanie and Dr. Pickett have mentioned in a different way, and that's to remember the 3 C's. Cover your face with a mask, avoid crowds, and avoid confined spaces. So if you do choose to gather, make sure that you avoid high-risk behaviors, keep your distance, and avoid crowded situations, and avoid confinement. So outside is probably best if possible. Enjoy the great Texas weather. And again, don't forget to cover your face and keep your distance.
Thank you. Now to our pool reporter, Ryan Otulo from Austin American-Statesman. Ryan?
Good morning. The first question is from us. What would need to happen for Austin to begin treating patients at the convention center? Is that close to happening?
So we're not close to that point just yet. In order for the convention center to open as the alternate care site, we would have to have exhausted our hospital resources, filled all of the beds, filled the hospitals to capacity, and also exceeded their surge capacity as well. The hospitals are taking several measures to expand their capacity as much as possible to have extra beds. However, what we are finding a rate limiting step here is the staffing, where we have beds, we have equipment, but the staff are needed to take care of those patients. And as more people are out sick with the virus or exposure to the virus, then that reduces the available staff. We count on our hospital partners to let us know when it's time, when they need to cry uncle and when they're full, although we are monitoring their status on a day-to-day basis.
From Austonia, Dr. Pickett said yesterday that demand for COVID testing has increased, but that turnaround times are still quite quick. Are you concerned about lab backlogs like those over the summer?
Well, we'll always be concerned about that happening again, although we have more lab partners that can perform the tests, and our various labs have increased their capacity for performing those tests. So we're fortunate in that right now we are not bumping up against the limits of that capacity. If demand continues to increase significantly, then we may get to that point again, although right now we look like we're in very good shape.
And I'll just add that, as Dr. Pickett mentioned, there are plenty of labs out there in the community that are offering laboratory testing or tests available for COVID, and a lot of rapid testing that's gone online and is available to the community. So we hope that will help reduce the turnaround time. And we are seeing increases coming into Austin Public Health as far as lab results and reporting that we're following up on. But we're hoping we don't have that backlog like we did back in June and July.
From KVUE, last night, KVUE did a story on a nightclub reopening its doors Friday, despite Travis County prohibiting bars and nightclubs from opening. Does Austin Public Health think it's okay that the COVID-19 response team only works until 8 p.m. and therefore its code inspectors cannot find violations at bars and nightclubs that are open later?
The enforcement team is a team of several members. Along with code enforcement, you have the fire marshal's office, you have Austin Police Department, and environmental health services. And so the goal is that if anyone has a concern, we would want them to go ahead and call 311, and we would make sure that the appropriate individual will be dispatched for that response. One of the other things is very that we want to just remind folks, because a lot of times individuals don't want to reach out and make that call. But it is important for you when you have that call and you make that call to keep us all safe, and our staff will respond.
From CBS Austin, what does contact tracing show are the most recent spreader sites beyond extracurricular activities at schools and at private gatherings?
I would say some of the things that we're starting to see are club activities, like club sport activities, or activities where folks may be enrolled in, I don't want to say a gym, but lessons of some sort outside of the home. But they're sort of still kind of mostly tied to those extracurricular activities that you see. And again, a lot of them are still tied to social gatherings, people attending baby showers, people attending weddings, and in some cases, people attending funerals. Again, right now, I just want to re-emphasize, we're getting at the point where we have cases that are climbing each day, and we're seeing high numbers. We have widespread community spread of COVID. So if you are outside of your home and you encounter a person that is not part of your household, you are placing yourself at potential risk for disease transmission. So right now, I would say there isn't you need to be mindful that there might not be a safe place for you to be, that you need to keep your distance and avoid high risk behavior.
The department is averaging, our 7-day average is 300 tests in our community. And so it's important for us, as Dr. Pichette said, is that we are at a point of community spread. And so if you're around individuals that you may be even having dinner with, you tend to let your guard down with individuals that don't live in your household. So it's going to be important for you to maintain that mask when you are not eating, and make sure that you are also using your social distancing as well, even in a setting where you're having maybe a dinner with a friend. The other thing that is important that we are seeing across the board, you did mention extracurriculum, and that those are, pretty significant. So whether it's football, whether it's dance clubs, whether it is other types of clubs, those are the types of settings where we are seeing, that's where our contact tracing is showing the infections are happening.
Director Hayden, I think you said here 300 tests a day. Did you mean 300 cases a day?
300 cases a day, 300 positive cases a day. Yes, thank you.
I was going to say, we're doing a lot more than 300 tests a day. We're doing well over 1,000 tests a day.
From Co-op Radio, the initial national vaccine distribution plan is based on population, not on risk or COVID case numbers. Secretary Azar leaves it up to the individual states to determine how they distribute their pro rata vaccine allotments. What has the governor announced to you?
The department is working very closely with the Texas Department of State Health Services. We are in weekly meetings with them as we discuss the state's plan. It is going to be important for us to ensure that we get that information firsthand. We bring that back to our community and we share it with our partners, as well as our Vaccine Distribution Coalition Task Force. And so we will continue to provide those updates. So we will be ready to provide the vaccine when it comes to our city and town.
And I'll just add that the Department of State Health Services has just recently released the guiding principles and priority groups that their vaccine planning committee has established. And so they've created a vaccine advisory panel who's determined what priority groups would be the first priority groups to be vaccinated. And so as we obtain and collect that information from them, it helps us guide us in our planning so that we can be prepared to distribute vaccine accordingly.
From KXAN, what preparations are Austin Public Health and the Code Enforcement Department making to enforce COVID-19 guidelines on Thanksgiving? Will code enforcement officers be staffed and responding to complaints, or will that be left to the police and other departments?
We encourage individuals, if they have any concerns, to go ahead and dial 311. At that time, the responsive department will respond to that call. We typically do have individuals that are working, even if it is a holiday, and so we are ready to respond.
From community impact, does the city or county have any additional flu vaccine distribution events planned that will also serve as COVID-19 vaccine drills?
We have completed 2 events this year. One, a smaller scale event at Dove Springs Recreation Center. And then the larger scale event was held at the Expo Center. Prior to that, our staff participated in a virtual tabletop exercise. And so based upon that, those experience with those events, as well as our plans that we have in place, we are ready to provide distribution, whether it's at a clinic or whether it's at a pod. We are ready, point of dispensing unit. We are ready to provide vaccine to our community.
And I will add that you can always go to austintexas.gov, I think /flu or /flu, to identify locations where you can get a flu vaccine through our Big Shots program or our Shots for Tots program. Again, it's also available in commercial retail pharmacies. You can step up and get a flu vaccine in those locations as well. But again, as we begin our vaccine planning and distribution of vaccine, we're looking at all modalities that we typically use for vaccine distribution, whether it be for flu, to be used for COVID vaccine as well.
From KView, for those who are traveling, what recommendations would you give for them to do so as safe as possible? And what should they do when they arrive at their destination or return home from traveling?
Well, the first recommendation, of course, is to avoid traveling, particularly in groups and gathering with groups. The fewer the people you're around, the safer that's going to be. Anytime you have to be around others, we recommend that happens outdoors, that you wear a mask, and that you keep 6 feet distance between you and those others. Now, we are grateful to see that there are a lot of people who are going and getting tested right now, that this testing demand has increased. However, a test does not buy you a ticket to a gathering. As we've seen, you can be incubating the virus and test negative initially, and then still a day or two later develop symptoms and be infectious. So it's important that people understand the limitations of testing prior to gathering, that it does not mean that you are safe to attend the gathering necessarily. And of course, if you're feeling any symptoms, even mild symptoms, such as a stuffy nose, a sore throat, a fever, a loss of sense of taste or smell, then do not be around other people.
And I will just add to what Dr. Pickett says is in our case investigation, what we're typically seeing on a lot of our positive cases more recently is that many individuals think that they are suffering from allergies. So, I thought it was just allergy symptoms. Could be nasal congestion and scratchy throat or mild sore throat, and they end up being positive. So even some of these mild symptoms could be indicative of COVID-19. So if you experience any type of symptom, you need to consider that you are infectious in some way until you have a test that proves otherwise. So you need to be careful. Just to add on with what Dr. Pickett also said about travel, if you do travel, you need to avoid any kind of high-risk activities at your destination. So you are entering into a place or into somebody's home, and you have not been in their home for, for a 14, you haven't been able to quarantine yourself for a 14-day period, and you may have placed yourself at risk en route to that destination. So just be careful that you are just make sure that you are avoiding high-risk activities, keeping your distance, and making sure that you continue to wear your face covering when you are around other individuals.
Co-op Radio asks, what are your criteria for successfully achieving herd immunity in Texas?
So we think that immunity of somewhere around 70%, 60 to 70% of the population will help. However, it is very important that we do not try to achieve this herd immunity through the spread of infection. The mortality and the morbidity, the long-term effects of this virus are just coming to light now, and the personal cost of getting herd immunity through uncontrolled spread of infection is just far too high for us to bear. Our best bet for achieving that herd immunity is, as we have with other diseases, and that is through vaccination.
And a measure for success for me would see a downward trend of positive cases and a flattening of the curve again. That to me would be the ideal measure of success.
And for me, success would be is that, we have the vaccine, we have a cure, we have most of the people in Austin, Travis County has received that vaccine. And while we're moving through that process, we continue to wear our mask and social distance and wash our hands. And lastly, we definitely get that positivity rate below 3%.
From KXAN, how soon do you believe Austin residents will have access to the vaccine, and at what percentage? And does APH have any plans to assist rural areas with vaccine distribution?
Our vaccine coalition task force is a regional task force. We have members from Williamson County, Hayes, Travis, and Bastrop, as well as the state of Texas. And so in those conversations, we are definitely planning our efforts together. And so we are, with those relationships that we've built, for example, with Bastrop County, we are planning very closely with them because they are a smaller county. They're right next to us. And so it's going to be important for us to continue those conversations. As far as what we are anticipating, we have to follow what the state has provided for us as far as the timeline. We know the initial timeline in December, we will receive for phase 1. And so we're looking forward to phase 2 because phase 2 will have additional providers. So not just the hospitals, but it will also include Austin Public Health and community care, for example, but we'll have other providers that are typically pharmacy providers in our community. And so that will help us to be able to provide the vaccine across our community starting hopefully January, moving further into the year. We can never anticipate exactly how much we are going to receive, but we will be ready to provide the vaccine to our community with our partners.
From Fox 7, what is your level of concern that the airport is full of people traveling? And are we going to see higher numbers post-Thanksgiving?
I'll just say my level of concern whenever I see any kind of people congregating in any situation is that they are placed themselves at risk of disease transmission and being potentially exposed to a COVID positive person. We are already in a state where we have increases in cases in our community and throughout the United States and throughout our state. The city of Austin's faring much better than other areas of Texas. However, we do have increase in cases. And so I would definitely expect that in 2 to 3 weeks, we will have an even higher number of cases that result from gatherings that occur over the Thanksgiving holidays. And I have concerns about that.
I share Janet's concern, and we know that folks are getting together during this holiday season. We know that these family gatherings are driving a lot of spread of infection, and we will, as we did after Easter and Memorial Day and Independence Day, we will see families that are devastated by the spread of this disease. According to an Ohio State study, the respondents, 38% of them said that they did plan to gather in groups larger than 10 during the holiday, and a quarter said that they had no intention of doing any kind of protective measures such as masking or distancing. So when I hear that and I see that here's this national holiday that is associated with family and togetherness, that worries me a lot for what we're going to see a couple weeks from now.
I too share the concerns that Dr. Pickett and Janet has shared with you. We know that we will do everything we can to really provide any type of assistance. We will say these are the things you can do that will be a low risk. These are the things that will be a moderate risk. And these are the things that will be a higher risk. And so as we have prepared in the past, we're hopeful because we've had some folks that have shared that they did make changes with their plans, and they are going to do things virtually. They have created new traditions, and so we are excited to hear about that. However, we are prepared with our staff and our teams just to be in a collaborative space once we return, and we'll continue to monitor how the infection rate is happening for us in Travis County.
Thank you, Stephanie. That concludes our media availability for today. We'd like to say thank you to APH Director Stephanie Hayden, Dr. Jason Pickett, and Chief Epidemiologist Janet Pichette, and to our pool reporter from Austin American Statesman. Thank you for joining us today, and have a great one.